Hey, welcome back. Rain, first day after vacation. If there's anybody out there who doesn't read his or her email, okay, the exams are scored, grades are posted. We gave everybody full credit for item 23. Those are the Bruner quotes, but now you know those Bruner quotes. And as I said in the feedback, if there's anything you should take away from a psychology or cognitive science major, it's those three things, okay? It sums everything up. The whole field is summed up in those three sentences. Okay, item 16 was a bad item. I don't know why. It just was. So we gave you 3 credits for it. And the exam was a little long. I know why that was long. I made it long. So everybody got 3 points for my misbehavior as well. You're going to get the exams back in discussion section. And when you get them back, basically you've got a week to ask for a rescore of any items you think were incorrectly scored. And remember that you can't just go to the GSIs and say, I want you to look at my exam again. Okay. Or and you can't go to them and say, I want you to look at item 12 again. What you got to do is do a little paragraph of writing and say why you think your response was at least as good as the one in the scoring guide, and then we'll deal with it. That's the distribution of scores. I don't think you get asked for a better distribution of scores, right? By the time we finished the rescore, a third of the class had perfect scores, another third of the class had almost perfect scores, and the rest were doing pretty well. That's not great inflation, but someday I've got to toughen up my exams. Anyway, that's the story there. Okay, when we first talked about social cognition, one of the points that I tried to make about differences between social cognition and non-social cognition, some of them were quantitative in nature, meaning that social cognition was more of something, had more of some feature than non-social cognition, like emotion and motivation is probably more important to social cognition than it is to non-social cognition. And some of those differences were qualitative in nature, which was to say that there are some features of social cognition that just aren't present at all in non-social cognition. And we're going to start talking about one of those today when we talk about the self. Because in social cognition, we're not just trying to cognize other people, we're also trying to cognize ourselves. So that in social cognition, the self is both the subject of cognition, which it is in non-social cognition too. You're the person who's doing the perceiving or remembering or thinking or whatever, but you're also the object of cognition, okay? And that's what we're going to talk about today. Interest in the self goes back a long ways in psychology, longer than in cognitive science, because psychology is older than cognitive science. I always like this part from William James, where he tries to talk about what psychology is all about. And he begins with his famous definition of psychology as the science of mental life. And then he says, well, let's think about this for a second, okay? It turns out that one of the characteristics of thinking is that thinking tends to be part of a personal consciousness. James's idea is that, every perception, every memory, every thought, every idea we experience as something that we have, okay? That's what he means by, it seems that the elementary psychic fact were not thought or this thought in the abstract, okay, but rather my thought, okay, every thought being owned. And then he goes on to say that, if that's the case, then the self, rather than thinking, ought to be the primary focus of psychology. The universal conscious fact is not that feelings and thoughts exist, but rather that I think and I feel. And what we want to do today is and the next time, is to talk about how this notion of I, the notion of the self, is discussed in the study of social cognition. Again, James just didn't leave it at that. He argued that if you analyzed what people meant by the self, there were actually a couple of different aspects of selfhood that needed to be discussed. He distinguished first between the material self, the social self, and the spiritual self. The material self consists of all the material substances that surround your self, including your body, your family relations, the physical bodies that you're related to, and also your possessions. There's a kind of material culture of the self, I think the anthropologists would call it, where many of our physical possessions are really expressions of ourself. If you're the kind of person who owns a Volvo, then you're not going to buy a Cadillac SUV. Okay, that's an expression of your selfhood. Ringtones these days can be thought of as an expression of selfhood. When you go around and you find somebody else has your ringtone, you get upset. Okay, I don't get upset because mine's just a standard bell, but people do get upset and they say, "Oh, why does he steal my ringtone?" It's like going to a party and people find that somebody else is wearing the same dress. You know, that dress is an expression of you, and you don't want somebody else to have it. How bridesmaids get along, I don't know, but that's probably the exception. Gordon Allport was very puzzled by the self, and he kind of set in motion a lot of puzzlement within psychology and later cognitive science about the nature of the self. So it says, okay, referring to James, who's the self? Who's the I who knows the bodily me, who has an image of myself and a sense of identity over time? I know all these things, and what's more, I know that I know them, but who is it who has this grasp of myself? It's much easier to feel the self than to define the self. Well, people thought that for a long time, but I think it's really just not true that it's not easy to define the self. I think it's actually pretty simple to define the self. What we mean by the self in psychology and cognitive science is your mental representation of yourself. Just like you have a mental representation of other people, you have mental representations of other objects, you have a mental representation of yourself, which at a first glance, okay, includes your sense of what your attributes are, what your features are, those features of which you're aware. And so your self can include your awareness of your various traits. If you're a neurotic extrovert and you know that about yourself, neurotic extrovert becomes part of your self-concept. If you're usually happy and you know that about yourself, then I'm usually happy becomes part of your self-concept. Your goals, you want to go to medical school, your appearance, you're not too bad looking, your demographics, you come from a working class family, your possessions, you have a Volvo, your relationships with others, you're married or you got a steady boyfriend or something like that. All of that, all of those attributes of yourself that you're aware of are part of your self-concept, and it's really not any more complicated than that, I think. The really interesting part is when we try to figure out how do we actually represent these things, these features of ourselves, mentally. That's the question for cognitive psychology and for cognitive science. And again, there's a fairly straightforward answer because both cognitive psychology and cognitive science have a kind of a standard view of what forms mental representations can take. John Anderson, who's a theorist that I pay a fair amount of attention to, makes a very nice distinction between two basic forms of mental representation: perception-based mental representations and meaning-based representations. Perception-based representations are mental representations that represent the physical appearances of things. So what things actually look like. They're like images. They're like pictures in the head. And again, there may not be pictures in the head. Let's not get into that at the moment. But what they represent are the physical appearances of things, including the spatial relations among objects, whether something's up or down or left or right or near or far with respect to something else. They also represent the temporal relations among events, whether something occurred earlier or later than something else. So all these perception-based representations kind of take the form of so-called analog representations or mental images. They're like something like pictures. Meaning-based representations, by contrast, are representations that are abstracted from perceptual details. They're nothing like a picture. They're more like words or phrases or sentences, and what they represent are the meanings of various objects and events, the implications of objects and events, category membership of objects and events, not their physical appearance and their spatial relationships and all of that. Whereas we can think of perception-based representations as somehow similar to a mental image, we can think of meaning-based representations as represented in a propositional form, as sentence-like verbal descriptions of things rather than actual images of these things. So if you start out by saying, look, the self is just your mental representation of yourself, and then you say, well, you want to say, well, okay, go say more. What does that mean? Well, we turn to cognitive science and cognitive psychology. Say, well, what do mental representations look like? Well, they come in two forms, perception-based and meaning-based. And in this lecture today, what I want to do is expand on these and talk about how we could think about the self as a perception-based representation, mental representation of ourselves, and how we can think about the self as a meaning-based representation. And we're going to do the meaning-based one first. The easiest way to think about a meaning-based mental representation is to think about the self as a concept. Now, the self concept is a term that's probably familiar to all of you. It's probably familiar to all of you before you ever darken the door of a psychology or a cognitive science class. It's something it's a term that's very prominent in popular culture, and what it usually means is self-esteem. Oh, he's got a bad self-concept, or he's got a strong self-concept, or something like that. That's not the idea here. The game that we're going to play is to be very, very concrete about terms like self-concept, and we're going to say, well, look, if you got a self-concept, then we can think about this self-concept the same way we think about other kinds of concepts. So let's begin. We think about the self as a concept. So the self, it can be represented by a list of attributes that are in some sense characteristic of ourselves and also tend to differentiate ourselves from other people. When we ask somebody what their self-concept is like, what we ask them is, how are you different from everybody else? What's the essence of your uniqueness? And again, these attributes go way beyond merely recording people's self-esteem, whether they feel good about themselves or feel bad about themselves, whether they think they're good people or bad people. Now, when we talked about social categorization, and when you read the corresponding chapters in the Fisk and Taylor book, you were introduced to a number of different views of category structure. The classical view of categories as proper sets, the prototype view of categories as represented by kind of an average of the instances in the category, the exemplar view, which argues that categories are represented by the examples themselves, not just by a list of features that they tend to have in common. And then this more recent theory-based view that says that what holds a concept together is a theory of the entities that are being categorized. The next step then, once we've decided to treat the self-concept as a concept, is to try to figure out how these various views of the self apply. What does the self look like from the view of conceptual structure? Now, we know now that categories are not mentally represented as proper sets, despite what Aristotle wanted to think. That just doesn't work for us. But I want you to sit back for a second and think about what it would mean to think about the self as a concept that's represented according to the classical proper set view. What that would mean is that there's a set, okay, a concept, there's a set of objects, okay, but it contains just a single instance, okay? That's you, okay? You're in the self-concept, and everybody else is not in the self-concept because you are you and they are they. So what you would look for if you thought about the self concept in terms of the proper set view of category structure, you'd look for the self concept to consist of those features which set the self apart from everybody else. And again, if the self-concept is a proper set, an Aristotelian proper set, we'd look for these features to be defining features, features that are singly necessary and jointly sufficient to distinguish oneself from others. Now, you can think about the self that way, and it's not a bad place to start, except we already know that the proper set view of category structure isn't right, okay? That there are other views, like the prototype view, that are more accurate views of category structure. And it turns out that while this looks very simple, the idea of the self-concept as a proper set, characterized by a list of features that are singly necessary and jointly sufficient to define oneself, it just has all the problems that all categories as proper sets view. So that's really a non-starter. What's much more popular in the study of social cognition, as with categories of other people, is the view of the self-concept as a prototype. And remember that prototypes are also summary descriptions of whole concepts, okay? Except that whereas in the proper set view, the concept is represented by a set of singly necessary and jointly sufficient features, the self is, from the prototype view, the category is represented by a prototype that's abstracted across a number of different instances, okay? So you've got a concept of fish, and the features that are characteristic of fish are abstracted from particular fish, like trout and salmon and sharks and things like that. And the idea is that the members in the category share a family resemblance with each other. Okay, now that's fine. You can think about the self as a prototype, and if you go into the social cognition literature, you'll see articles by various authors who construe the self-concept in prototype terms. But you got to start thinking for a second, wait a minute. The prototype is abstracted across a number of different instances. My prototypical fish is abstracted from my observations of trout and salmon and sharks and guppies and whatever, okay? But there's only one of me. How am I supposed to abstract some kind of average when there's only one of me, okay? That's not going to work, okay? If each self is unique, as we think we are, okay, then how do you get family resemblance across something where there's just one of you and you're uniquely different from everybody else? Well, I think the solution to this problem can be found in a variant of social cognition that actually is more familiar in sociology than anything else. One is the work of Cooley and Mead on what's known as the looking glass self. Cooley and Mead argued that the self consists of, first, whatever attributes are associated with first-person pronouns. I'm a neurotic. I'm an extrovert. I'm relatively middle class. I'm whatever it is that I am. But then they went on to argue that from a sociological point of view, each person possesses as many selves as there are significant others in his or her social environment. So if that's the case, this looking glass self idea is right. Now we know where the self as prototype comes from. Yes, there's just one of me, but there are lots of people out there who are significant others in my environment. There's my wife, there are my family, there's her family, there are my colleagues, there are my students, and so on. And what I can do is I'm going to form a self-concept. I'm going to abstract across how I'm viewed by them. And what's going to go into my self-concept is going to be a set of features that have the set of features that tend to be associated with each of these different looking glass selves. Okay, so that's entirely possible. So Cooley talked about this. Mead put it a little bit differently. The person has as many selves as there are social roles for him to play. Not so much in terms of significant others, but in terms of social roles. I'm a husband, I'm a brother, I'm a teacher, whatever it is that my social roles are. There are attributes associated with each of those, and my prototypical self is abstracted across those. It represents a kind of average across those. Question? Yeah. Yeah, this is the famous Cooley and Mead of symbolic interactionism. Yes, exactly so. Okay, so now that gives us some idea about how you could have a self as a prototype, where prototypes are typically abstracted across multiple instances or multiple examples of a concept, how you can do that when there's only one of you. It turns out that from a sociological perspective, there isn't just one of each of us. We have as many selves as we have significant others. If you're Cooley, we have as many selves as we have roles to play if we're Mead, and this single prototypical self might be abstracted across those. Okay, so the first thing is, it turns out that the self isn't unitary and monolithic. It might very well be that we have a multiplicity of selves. We don't have a single unitary monolithic self-concept. Instead, we have lots of different self-concepts, and the self as prototype, the prototypical self, is somehow abstracted across those. We know that there is a lot of contextual variability in behavior. When I'm with a student and the students in class, I'm a somewhat different person than I am when I'm in a seminar room, or when I am in office hours, or when I'm home having dinner with my spouse, or whatever it is that I'm doing. And I have those different situation-specific selves represented in my head, and I can abstract across those to get a single prototypical self that represents how I tend to be across all of them. Okay, so that's how we might get a prototypical self. We have some representation of what we're like with friends. We have some representation of what we're like with family members. We have some representation of what we're like with our significant other, okay? And the prototypical self is somehow abstracted from these instances. The key to the self as a prototype is the idea that we don't have just a single self. We have lots of different selves. Okay, now I don't want to spend a lot of time on this because I want to talk about the self-image as well, but you can kind of now expand this a little bit. Remember that the distinction between the prototype view of concepts and the exemplar view of concepts is that the exemplar view dispenses with this idea that there's any summary representation of instances, okay? So that when you categorize an object as a bird, you don't compare this new object with some prototypical bird. You compare it to particular birds that you know. In the same way, we might do away with the prototypical self and simply say, there's no hierarchy, okay? I just have in my head a concept of what I'm like with my friends, a concept of what I'm like with my family, and an idea, a representation of what I'm like with my significant other, and my self-concept consists of those particular exemplars. Possibly. Here's an interesting puzzle for people who would be interested in mental representations of the self, and that is the clinical syndrome known as multiple personality disorder, more recently known as dissociative identity disorder. I don't really like that term, much rather have multiple personality disorder, but this is a very, 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 very rare syndrome, despite what you see on television, okay? You can go your entire career and see only one of these. I'm 61 years old. I've seen one, and I've been looking for them all my life, okay? But what you see in multiple personality disorder is a patient who possesses multiple different identities inside the same body each of these different identities is associated with a different set of autobiographical memories. And to make things even more interesting, there is an interpersonality amnesia that prevents one personality from knowing about the existence or the activities or the experiences of another personality. An interpersonality amnesia that is typically asymmetrical. To give you a good concrete example of what this is like, let's look at a famous case that was turned into a movie, The Three Faces of Eve, based on a real case of multiple personality disorder from the early 1950s. There were, in this case, there were three people. Eve White was the person who contacted the psychiatrist Thigpen and Cleckley for help because she was experiencing what she described as periods of blackouts. When the case was treated, it turned out that she was a classic case of multiple personality disorder. There wasn't just Eve White, who was a kind of demure, kind of boring rural Georgia housewife. There was also Eve Black, who was this sexy, sultry, negligee-wearing person who really puzzled her husband quite a bit. And then there was Jane, who was a third personality who began to emerge in psychotherapy. Eve White knew nothing about Eve Black and knew nothing about Jane. Jane and Eve Black knew all about Eve White, and Jane knew about Eve Black, but Eve Black didn't know about Jane. That's the asymmetrical pattern of interpersonality amnesia that's characteristic of this syndrome. But the point is that if you asked Eve White what she was like, she could tell you. She had a very good sense of what she was like. And if you asked Eve Black what Eve Black was like, she could tell you. She had a very good sense of what she was like. She was very, very different from Eve White. These were different identities, different concepts of self, all clustered within the same body. Now, in some sense, we all have multiple personalities because we all appreciate that we're different people in different contexts. Okay? We all know that about ourselves. The difference is we know when we're in one context we're being different than we are in some other kind of context. We have some awareness of that, but these guys, they don't, because the various personalities, the various self-concepts are separated by this interpersonality amnesia. So here's an example of where you might have multiple self-concepts that are not integrated with each other at all, kind of an exemplar view of the self taken to the extreme. Okay, that's really all I want to say about that. I'm going to skip over the business of self as a theory of oneself because I want to talk about the other kind of knowledge structure that's relevant to the self-concept, which is the perception-based representation of the self. And remember, perception-based representations are like mental images. So if the self is your mental representation of yourself, and mental representations can take two broad forms, meaning-based, largely verbal representations, or perception-based, largely imagistic representations. We've just talked about the self-concept as an example of a meaning-based representation of the self. Let's talk about the self-image as a perception-based representation of oneself. And again, in colloquial terms, self-image usually means self-esteem. Oh, he's got a bad self-image, okay? Which means he thinks bad thoughts about himself or something like that. We're not talking about self-esteem here. Again, the goal is to make progress conceptually by being very, very concrete. Talk about self-image as the image that we have of ourselves. Psychoanalysts from the early 20th century, Schilder, defined the self-image in exactly that way. The picture of our own body, which we form in our mind, the way in which our body appears to ourselves. Again, not our body as it would be physically measured, say in the doctor's office, not our bodies as they appear to other people, but our bodies as they appear to ourselves. That's what the self-image is all about from a cognitive point of view. And it's pretty clear we have one. It's clear we have one in part because we have perception-based representations of other people as well. We close your eyes, think about your boyfriend, your girlfriend, your mother, your father, your dog, your cat. Oh, there's my cat. Okay, Fedora this time. All right. We have these images in our head that represent what people look like. Okay, that actually reflect their physical features. We have auditory images in our heads. We carry around auditory images of what other people sound like. Somebody calls you on the phone and says, "Hi, it's me." Okay? Well, what are you supposed to do with that, right? Okay. If you're like most people, you know more than one other person, right? You're supposed to recognize who that person is on the phone, and you do. And the way you can recognize someone is not by looking at the phone and recognizing their phone number the way you can on some cell phones, but because you have internalized a perception-based representation of their voices. We make judgments of other people based purely on visual information that reflects their relative age or their gender or their relative power relations, like in the baby-facedness literature. And we know that we can extract information from people's faces. So we know we have perception-based representations of other people. It stands to reason that we have perception-based representations of ourselves. The British physiologist Henry Head referred to our internal representations of our bodies in terms of the body schema. He argued that you had to have in your head some kind of postural model of your body in order to engage in any kind of behavioral activity, like walking or swimming or just moving around in space, and that we can distort these perceptual representations of ourselves in various ways. For example, in the famous prism adaptation experiments, you put prism lenses on people that distort space so that when they're looking forward, they're actually looking at a piece of space that's 45 degrees off here. So, okay, well, we want you to reach for this object, and they reach here. They don't find it because it's really over here, right? And people can adjust over a period of time. They can learn where their bodies are in space. We have some internal representation of our body and its parts and where they are, and that's the beginning of the self-image, viewed as an image, not as a euphemism for self-esteem. Here's a really nice example of the experiment that shows that we do have something like a perception-based representation of ourselves, as well as perception-based representations of other people in their heads. If you had intro with me, you've heard me talk about this experiment before. It's one of my Faustian experiments, one of those experiments that I would sell my soul to have done myself. It's a really clever experiment based on what Robert Zients called the mere exposure effect. Okay, mere exposure effect simply says that we tend to prefer things we've been exposed to frequently in the past. That's all it is. Okay. But what Mita and her colleagues did was to do a demonstration of the mere exposure effect with people's facial images. What she did was to take head-on photographs of college students and their friends, and then she, basically using Photoshop, though it was 1977, it wasn't Photoshop, reversed half of the images so that they were the mirror, the reversed mirror image, okay? And then she simply presented people with photographs of themselves and of their friends and asked them to pick out which one they preferred, okay? Now, the idea is that when your friend is looking at a picture of you, he or she will prefer the picture that is the true photograph of your face. But when you look at a picture of you, you'll prefer the mirror reversed image because that's how you see yourself. That's how you see yourself in the mirror. That's where your self-image comes from. Here's an example of this. This is, of course, Marilyn Monroe, and you can ask somebody which of these pictures of her you prefer, and what generally happens is that people tend to prefer this one to this one, okay, and that's because there's Monroe's birthmark, okay, that's where we expect to see it, and that's what we think is right. However, when Marilyn Monroe looked in the mirror at herself, that's what she saw. And so if we had asked her which picture she preferred, she would have preferred the reversed Marilyn, okay? That's, in fact, exactly what happened in the META study. Here are two studies where people were looking at pictures of themselves and of their friends. And when people looked at pictures of themselves, they preferred the mirror reversed image to the true picture. When people looked at their friends, they preferred the true picture to the mirror reversed image. These are just friends. These are actually people that the subjects were dating, okay? And you got the same effect. A really nice reversal. The fact that people prefer mirror reversed images of themselves, that is, inaccurate images of themselves, suggests, A, that they do in fact have some kind of mental picture of what they look like in their heads. That's the self-image. And also suggests that it's derived largely from looking in the mirror. Talk about the looking glass self. There really does seem to be something like that. So here you have a demonstration that we do seem to carry around in our heads some kind of image, some analog representation of what we look like, and that we use this kind of perception-based representation to make various kinds of social judgments. Okay, so that's the META study. Now, the self-image viewed as an image has not been studied all that much in psychology to date, though there are places where you can see it. Back in the old days, when I took clinical training, one of the tests we were taught to administer and score and interpret was something called the draw a person technique, where you'd put down a piece of paper, a blank piece of paper, and you'd ask the person simply to draw a picture of yourself or draw a picture of some other person, and then you'd engage in some kind of arcane the scoring of this. You know, if they have big feet, well, they're on a journey or something like that. But the fact of the matter is that when you ask people to draw pictures of themselves, assuming that they're competent draftspeople, okay, well, you're going to get some kind of sense of what their image is. The problem with the draw a person technique, of course, is that most of us can't draw worth a damn, okay? So that's not a very good way to get at people's self-images. If you don't believe me, after class, when you're sitting having lunch or something, just take out a piece of paper and try to draw yourself and see how much you like the results. It's not good. Okay. There are, interestingly enough, verbal questionnaires that try to get at people's body images. My favorite from some colleagues of mine at the University of Wisconsin, Lauren and Jean Chapman, is the body image aberration scale, where people are asked questions about their body images. So one of the subscales is unclear body boundaries. Sometimes I've had the feeling that I'm united with an object near me. I am the coffee cup or something like that. Okay. Feelings of unreality or estrangement in parts of my body. I've sometimes felt that some part of my body no longer belongs to me. Or feelings of deterioration. I've sometimes had the feeling that my body is decaying inside. Perceptions in the size of body. My hands or feet sometimes feel far away. I will never forget going on a job interview once and being interviewed by a distinguished senior psychologist who I didn't know from Adam before the interview. And he looked at me and he held out his hands and he said, "Do you think my hands are growing bigger?" Okay, I've never met you before, I don't know, you know. Okay, here, changes in the appearance of the body, you know. Occasionally it seems as if my body's taken on the appearance of another person's body. People will sometimes actually say yes to questions like this, right? And the idea is that when people say yes to questions like this a lot, okay, they have some kind of distortion in their body image. But probably the best way to assess people's perceptions of body image is by actually asking them to work with imagistic materials, with perception-based materials, rather than with verbal descriptions of this sort. A very good example of this comes from research by lots of investigators now. This is an early study of people, the college undergraduates, perceptions of desirable body shape. What is done in studies like this is you present subjects, male, female, doesn't matter, with line drawings of either male or female bodies, usually attired in swimsuits, and the bodies range from pretty thin, really, really thin, to really, really not so thin. And then you simply ask people to indicate which one they resemble most. So you can ask people to indicate which one most closely resembles their current body, or their ideal body, or what kind of body they find attractive, what kind of body they think would be attractive to the opposite sex, or for that matter, the same sex. It doesn't really matter. This is an assessment that is frequently used in studies of eating disorders, typically with women, but also with men. Here is an example of this. Again, this is from the study by Fallon and Rosen. So you've got women, in case you hadn't figured that out, and men here, somewhat thin, somewhat thicker. And then what you've got are the point where people rank their ideal body shape, the body shape they think is attractive, the body shape they think is attractive to other people, and what their current body shape is. And this study reveals a very common finding in this literature, which is that for college women believe that their current body shape is somewhat discrepant from the ideal or the attractive. College men don't have this problem, okay? Which, again, I think just goes to show you the difference between your own image and somebody else's image of you, because it's pretty clear looking around campus that quite a few men do have this problem, right? But here, look, you know, here's the ideal. There's the current body image. There's the attractive body image. So right on top of each other in a way that the average college woman just doesn't have. Okay, so now what you can do is, I mean, this is a direct assessment of what people think they look like. What you'd then like to do is to actually get some kind of objective assessment of what these individuals look like, which is not something that you see very often. But the point of this is simply that this is a way of getting at people's perception-based representations of their bodies. I'll skip over the generational study. This just simply shows you that looked at college women and their mothers, college men and their fathers collecting the same kind of data. Now, what's really interesting about this is when you look at clinical samples of, say, people who are actually carrying a psychiatric diagnosis of eating disorder. Here is such a study. Again, college undergraduates classified as eating disordered or not based on a questionnaire known as the Eating Attitudes test. So there are women who are high or low on eating disorder. Men don't, the Eating Attitudes test is really geared towards women. Men don't usually show up as eating disordered on it. They're just there for comparison. And when you look here at the eating disordered individuals, eating disordered women tend to perceive their current bodies as quite far removed from their ideal or what they consider to be an attractive body. Non-eating disordered women show much less discrepancy between the way they perceive their current bodies and what they think is the ideal or the attractive. And then men, of course, they're men, right? But again, the point here is that one of the sources of eating disorders is the perception of one's body. Eating disordered individuals, whether they're male or female, tend to perceive themselves as much fatter than they really are. Now, all you got to do is look around, and you can see there's a fair amount of overweight in the world. That's a major problem. So we're not talking about whether they're actually fat or not. We're talking about how they perceive themselves. These individuals are perceiving themselves, presumably, as much fatter than they need to be. Here, for example, is another study of body image disturbance in bulimia, where they looked at bulimic women and normal women, that is, non-eating disordered women, who were statistically matched for their actual weight. So we've got a pairwise comparisons of women with their actual weight. And what you can see here is that the bulimics, okay, saw a much greater discrepancy between their current weight and their ideal weight than the normal women did. Again, it looks like we don't have just one body image, one self-image. We got a couple. We've got the body that we think we have and the body that we want to have. Here's a very nice example of this, where the bulimic patients show a much greater discrepancy between their actual and their ideal the body image. These are all, again, equated for weight. So very, very, very nice finding. So there are eating disorder is one place where we can see clinical disorders in body image, clinical disorders where people have an internal analog representation of their bodies that seems to be quite discrepant from what they're really like. And then just to go back here for a second, there are lots of places where you can see this. In schizophrenia, one of the common features in schizophrenia is a distortion in body image. I've already talked about eating disorders. There is a wonderful neurological syndrome associated with damage to the left parietal lobe known as body image agnosia. Sometimes in the literature you'll see it referred to as autotopagnosia. Auto, self, topo, map, agnosia, knowledge. Okay, they don't have a good map of their bodies. People with body image agnosia can't locate their own body parts. If you ask them, where's your hand, they can't tell you. Okay, they don't seem to have an internal representation of it. Phantom limb pain also has some of the qualities of a distortion in body image. In phantom limb pain, amputees will feel pain in a limb that they don't have. Okay? So there's an internal representation of the limb, even though the limb is not physically present. And then finally, in body dysmorphic disorder, this is another very interesting clinical syndrome where people are obsessed with what they think of as flaws in their the physical flaws in their bodies. My nose is too large, my ears are not even, or something like that. And what's interesting about what recently called this body dysmorphic disorder is not just that the people are obsessed with this alleged flaw in their appearance, but the point is there is no flaw in their appearance. They perceive their bodies in a way that's quite different from the way their bodies actually look. Again, in these kinds of clinical syndromes, we can see evidence for a perception-based representation of the self, an image or a mental picture of ourselves that represents what we look like to ourselves, what we think we look like, which may be quite different from the way we appear to other people. Okay, two views of the mental representation of the self. First, the self as concept. Second, the self as image. On Wednesday, we'll look at a third view of the mental representation of self, the self as a knowledge structure encoded in memory. See you then. Thank you very much.